1 in 5 Ontarians will experience a mental health and/or addiction problem during their life. This impacts their thinking, feeling, moods, and ability to relate to others. In the case of Tomas, he, like many other sufferers of mental illness, began to experience difficulties as a teenager.
And I'd run away from home and everything, and just getting in a lot of trouble that I normally wouldn't have been in.
Had his parents known it was prodromal symptoms of an illness, they probably would never have kicked him out, but they didn't really feel they had any choice. They just couldn't put up with his behavior anymore. They didn't know there was anything wrong, so Tomas was out the door. This is kind of when Tomas started to kind of notice that something wasn't going right. He was working at Max Milk, living on his own, and going to school, and then he started to kind of have more acute symptoms. That's where the illness kind of starts to, there's signs that are kind of noticeable to you that something's wrong and that you may need to get help.
Yeah, I was paranoid all the time, thinking people could hear my thoughts and stuff. Well, actually, I tried committing suicide a few times, but that after a while of suffering through this, I thought I was talking to aliens too at one point, so it was pretty bad. Well, I was sitting in a classroom just like this, and someone from CMHA came in, and they were talking about schizophrenia and everything. And I was sitting there and thinking I was talking to her in my mind, telling her, "Oh, that's me, I'm schizophrenic and all this." But so she obviously didn't respond to me because it didn't really happen. But I got the phone number and everything, and I called them a little while later and got an appointment with one of the workers there.
Tim Heath describes why many people don't seek help to address their mental illness and the negative impacts that avoidance may have on their mental health.
When we're ill, we don't want to go to the doctor. We always kind of put it off. Just want to give that 3-week test, 3-day test to see if it kind of goes away. Mental illness is no different. People don't want to go to see the doctor when they think they have some kind of a mental health problem. But the symptoms won't go away on their own. They may kind of go away for a period of time, but maybe then they're going to come back. So it's important that when you first think you need to go for help and see what help you can find. Oftentimes people see being sick as a sign of weakness. It's kind of just a stigma out there that it's the person's character that's at fault, not the illness at fault. When you have a mental illness, it's not something that's in your control. It's a chemical imbalance in the brain that needs to be resolved, and you can't just stop it. It's not that snap finger, just snap out of it, your things will get better kind of thing. It's something that needs some treatment. A lot of people are scared of going to hospital. With mental illness, they're not going to put you in hospital right away. The idea is to keep you out of hospital. It's actually very hard to get into hospital. You have to be a danger to yourself or somebody else. So if anyone thinks that they're going to have to go to hospital just because they go see their doctor for a mental health problem, that's not what's going to happen. And the big reason people don't seek help is the stigma that's out there. Mental health has a bad name. You don't want someone to know that you have depression and anxiety. It's kind of got a bad name out there. But it's very normal. 1 in 10 have depression, 1 in 10 have anxiety, 1 in 5 have mental illness. It's very common in our society, but we don't see it, we don't talk about it.
The Enhanced Early Intervention Program at CMHA is helping people like Tomas regain their life and their independence.
It used to be, I think, that people got treated for mental illness at a young age when things were going wrong. They got into hospital and things started to feel better. They got released into the community, and there was really no supports for them. They were feeling fine. They'd go off their medication slowly and end up back in hospital. With early intervention, we want to kind of stop those relapses from happening. We want to get someone into hospital, get them treated, get them out of hospital, and keep them out of hospital so they can stay in the community and not have to have relapse after relapse. So the importance of early intervention is that it helps you improve your treatment outcomes. You get treated early, you have that first episode, and you don't have another episode, your chances of going on to live a full normal life become that much greater. Every time someone has a relapse of their illness, there's a greater chance that they're not going to have a full recovery, so we want to make sure that we're reducing the amount of relapses people have.
While getting a patient help is a vitally important component to addressing their mental illness, establishing ongoing support ensures a greater chance of recovery.
First step, we have discharge planning. A lot of times people would go to the hospital, to get on their medications, and they get into the community, and their support's kind of gone, and they haven't linked with anybody while they're in hospital. At CMHA, we have someone right up in the hospital. If you go into the hospital, you're going to meet with a discharge planner before you leave. So if you're wanting service from us, it's going to be offered to you, and that engagement process can start while you're in hospital. It's sometimes easier to engage someone while they're in hospital than to, once they get out in the community, to kind of go call them up and knock on the door and see if they want service. It's better to do it while they're in hospital. We have vocational support so that if when someone starts suffering from mental illness, they often get derailed from their school or from their job. So we want to make sure that we're helping them get back into the schools, back into their work, so they can kind of go on and succeed and meet all their goals that they have.
By providing the supports, education, and tools that patients need, they are able to work towards a lifelong care plan.
And we also have an aftercare program so that when someone's finished with treatment, we're not going to be around for a lifetime. The hope is 2 to 5 years you're going to come in for service, we're going to get you stabilized, educated, and feeling good again. But then you got to go back out in the community with your family and kind of deal with this thing for the rest of your life. So we want to make sure you have the supports. So once our service is kind of done, we have someone kind of follow you for a brief period of time to make sure things are going okay. And if not, we'll bring you back in for service. But if they are, that's great, and we're glad.
For more information on the CMHA Enhanced Early Interventions Program and mental health, please visit the following resources.